So here is an example, when we get to that next slide, of what your plate can look like. What your plate can look like. And I don't know if you can see that clearly, but I like to teach what is called the half, quarter, quarter rule. The half, quarter, quarter rule. So you're gonna fill up half of your plate with vegetables. Why are we choosing vegetables? They offer less sugar compared to other foods like your fruits and your starches, right? So we're going with half the plate vegetables, and then we're going with a quarter percent, well, not percent, but quarter of the plate being starches, so the rice and the ground provision and all those things that we just listed, and then the other quarter will be your protein foods. Now you want to choose protein foods that are lean, so lean cuts of chicken. If you're doing red meat, lean cuts of that food, meaning they don't have as much fat. And you could keep your fish and other types of seafood as well. And so that's what a plate will look like. And I know I put rice on that plate. I know for many people, when they get type 2 diabetes, they go, I ain't eating no more rice, I ain't eating no more pasta, I ain't eating no more bread. And for some of us, that is unrealistic. Because think about us as a people, Caribbean people. We love to eat rice. And so if I just come and say, you know, you can't have that rice no more, that's it. That's gonna be a challenge. So we want to look at the amount, and you see that we have it as just a quarter of the plate. Typically what we do is we make the rice half of the plate. We don't want to do that, just a quarter. All right, you can move to the next slide. So I have a few tips for you in terms of planning your meals. The first tip is to plan your meal in advance. When you have type 2 diabetes, balance and consistency is going to be your friend, and you want to plan those meals in advance. That means on Friday or Saturday, whenever, you sit down and think about what you want to eat for the upcoming week, okay? Think about what you want to eat for the upcoming week, make a grocery list, so that you can be set up for success. And here is where you're going to intentionally include those vegetables, intentionally include those whole grains. Okay, next slide, please. The second tip is to keep it simple. I don't know how many of you have this experience where you decide to make a lifestyle change, and then you go on Pinterest or Google or whatever, and you're looking for all the fancy recipes because they're healthy and you're trying to see what you could make. Sometimes when you're making a lifestyle change, it is best to keep it as simple as possible to reduce the frustration that you might get from trying to do too many things all at once. So you want to keep it simple. And the third tip is to meal prep. I want you to say this with me. Meal prep saves lives. I know we're in church and Jesus saves lives too, but meal prep is also going to save your life, okay? If you prepare, like I said, at the beginning of the week, after you've already thought about what meals you want to eat, you've kept it simple, you've included your vegetables, you've included your whole grains, you want to meal prep at the beginning of the week. Now, meal prep can take two forms. I don't know if you've seen those pictures on the internet where people have the trays of food, and in every single tray, it's the same thing. That is one type of meal prep. You don't have to do that, because what happens, you tend to get bored, you get food fatigue. You don't want to do that, okay? Another type of meal prep that you can do is to do things like cut up your onions and your seasonings and things like that, cut up your vegetables, season your meats, batch cook your grains, so your rice, whatever grains that you plan on eating that week, batch cook those. And so throughout the week now, it's gonna be easier to put a meal together. I don't know how many, again, of you have this experience where you come home and you're tired from work, and now you got to wait for the chicken to defrost, right? No, if you've seasoned that meat ahead of time, then you eliminate that, you maximize the chance of you having a healthier meal. So you want to meal prep at the beginning of the week, because meal prep saves lives. Next slide, please. So I have next for you a list of budget-friendly staples that you can include. I know, if we're being real, we live in a pretty food insecure community. Can we be real about that? We don't have as much access to fresh fruit and vegetable as we would like. And that's just the challenge of the day. So I've included here a list of budget-friendly staples that you can include in your diet. Things like eggs, rice is fairly inexpensive, oatmeal, and I have some canned fish here. We want to be careful with the sodium content, so look for low sodium things. And then you also have frozen fruit and vegetables. I know some people are afraid of the frozen, but if you can't find fresh, I would prefer that you do frozen fruit and vegetable as opposed to no fruit and vegetable. Okay? So frozen fruit and vegetable is okay. All right? And then we have some peanut butter, good source of protein. Your beans and legumes, those are fairly inexpensive. Diced tomatoes, potatoes, sweet potatoes. Those will be better for you as a type 2 diabetic than the regular potatoes. Next slide, please. And the last two things I want to focus on is the nutrition facts label. So it is very important for you to know how to read the label, and I could only touch on that tonight. That will require us to sit down and go through, have a session together so I can talk to you more in depth on how to read that nutrition facts label. But the crash course is this. You want to start with the serving size. So the label is going to tell you what is in that food. So you start with the serving size. The serving size on this particular food is 1 cup. So everything that follows after pertains to the 1 cup of whatever food that is, okay? So the first thing you want to do is look at the serving size. And then you just jump down to the total carbohydrates. All carbohydrates are going to break down into sugar, so that's why you want to be looking at that carbohydrate content, okay? So you look at the serving size, you look at the total carbohydrates, and try to determine whether or not this would be an appropriate food for you. Next slide. And then we have a few nutrients that we want to watch. We want to increase the fiber. So that's going to help to slow down the digestion of the food, slow the movement of sugar into the blood. We want to decrease, I said decrease, the sodium content, all right? So we're going to aim for 5% or less on the nutrition facts label. We're going to look for cholesterol, and we want to decrease that as well because that plays a part with type 2 diabetes. So we want to, again, aim for 5% or less on packaged foods. And then with saturated fat, again, that's going to, decreasing it is going to help reduce your risk for heart disease. And that is 5% or less on the nutrition facts label as well. Next slide. So the key takeaway I want you to know is that balance is key, okay? Balance is key on the plate. Balance is key in your life. And so that is going to be what will help you to manage those blood sugars. Next slide. And just some gentle reminders that everybody's body is different. Everybody's nutrition requirements is different. So what works for your friend may not work for you if the both of you have type 2 diabetes. So you really need to make sure that you are speaking to a registered dietitian to help you to to assess your nutrition needs. Everybody's body is different. Lifestyle changes take time. So you won't get diagnosed with diabetes today, and then 1 month later, everything is back to normal. Your lifestyle changes will take time, so you have to give yourself some patience, some grace. Don't try to rush it. You can live a long, happy, and healthy life, even though you have high blood sugars. I want you to know that. And then finally, nutrition care is available for each person, no matter what community you live in. So if for any reason you decide to leave the community of East End and you move to Road Town, you can have access to nutrition care. If you move to the island of Josephine Dyke, you can have nutrition care. For Jingada and Igada, you have access to nutrition care. And I want you to know that you are not alone. We are in this with you, and we want the best for you in managing your blood sugars. Thank you so much for listening to me. I appreciate your time. Next slide. If you do want to have a session with me or contact me for any reason, you can call me at the Virgin Gorda Clinic, 852-7753. You can also email me, amatthew@bvihsa. I am on Instagram at tony.rdn. I'm also on Facebook as Antonia Matthew Dietitian. So if for any reason you want to reach out, you have access to me, and you can reach me there. Thank you so much.
Thank you so much, Ms. Matthew. That was a wonderful presentation. Definitely she brought out some of the fears that persons have once they're diagnosed with diabetes. What do I eat now? Typically the Caribbean plate does not look like what the plate you showed there, the half, quarter, quarter. Yes, we may have half, quarter, quarter, but what the half is not necessarily the vegetables. That's typically the rice and peas and the macaroni pie and you name it, right? So thank you so much, Ms. Matthew. Any questions for Ms. Matthew before we move on? Everything clear? I do encourage us all to, take some time if we're uncertain, even if you don't have diabetes, but just to get some sort of encouragement and confidence in what we eat, especially. Yes, we have a question here.
Should someone need your service, you said you're accessible. Are you open to public service, and are those the contact information? If we have, say, someone comes to the Diabetes Association and needs further guidance in their nutritional, care, we can contact you and say, go down and see Ms. Matthew?
Sorry, yes, you just also want to instruct that person to see their primary care provider and get a referral. It's mostly covered by NHS as well, so they definitely can come and see me.
Wonderful question. No, as we spoke about, thank you, Ms. Matthew, as you spoke about food sources, one of our vendors here tonight is Nature's Way. How many persons have ever been to Nature's Way? Oh, see, fabulous. So Nature's Way is here tonight. Some of us can take a walk when we get to the breakout session where we're gonna visit each table, just to let you know some of the other persons we have here. Red Cross, BVI Red Cross is here, where you can learn about all things CPR, first responder, and I'm not sure if they do some sort of screening too, some aspects of screening. As you visit them, you can just ask as much questions as you like. Other persons, we have the community mental health team from the BVI HSA to provide all things counseling and just mental health coping with your diagnosis, as well as other social stressors that may come up. They'll have a presentation later. The Primary Care Services Department will be offering screening quite here on site from the Long Look and East End Clinic community. So you can visit that table, get your glucose level done tonight if you've never, or if you have and you just want to know what my sugar level is after all of this talking. You can do that, as well as get your weight, your height, recalculate your BMI, and your blood pressure reading as well, all right? So don't be afraid, just feel comfortable. We're here to help you answer any questions. We have also representatives from the BVI Diabetes Association, and we're very happy for the support. We're all here with the same objective, for awareness and increased access for diabetes care. So moving on, we have a wonderful specialist, Dr. Rodriguez, who will be talking to us about eye care. Now, typically, persons will see a general practitioner or an internist with a nursing team when it comes to managing diabetes. But one very serious complication of uncontrolled blood glucose levels is damage to the eyes, right? It starts slowly but progresses as the years go by. And Dr. Rodriguez will just be telling us key things to look for and stuff she'll be offering to us tonight in terms of screening. Please welcome Dr. Rodriguez.
Thank you. Good evening. First, I would like to apologize for any English mistake that you heard because the English is not my native language. Okay. First, I would like to know how many diabetes patients feel when the glucose level is high. Some change in the vision. Some vision change when the glucose level is high. How many patients feels some change in the vision when the diabetes have a discontrol, right? This is the first of the symptoms that the diabetes shows in the patient when something happened inside the eyes. The diabetes can to develop the diabetes retinopathy. The diabetes retinopathy is an eye disease that produces some trouble, some damage in the vessel inside your eyes, and for this reason, you can see well when the glucose blood level is high, because some change produce sometimes reversible or in other time is irreversible damage in your eyes. Some risk factor can to develop more fast all of these problems. I have some questions in the screen that I would like to answer this night with you. First is do any know how is the retinopathy diabetes? Before you hear about this? No? Okay, I explained a little simple before, okay? It's a vessel damage inside your eyes. The vessel damage is something like a hemorrhage inside the eyes, some tissue that hit inside the retinal tissue that is a more important structure inside the eye for you can see well. When all of this happened, the retinal tissue developed some area of a blood vision, and you can see well. How you know that the retinopathy, diabetes retinopathy is beginning to develop? The first symptom is some change in the visual acuity. You can see well, but when the blood sugar level beginning to up again, you can see more clearly sometimes, but sometimes not. When this happens, when the vision can come back clear again, it's because you have some more severe damage inside the eye, and you need to worry. What happened? I have a retinopathy, diabetes retinopathy, and in this time you need to check your eye because sometimes the ophthalmologist especially can to do many kind of treatment for help you, but sometimes if you can get the correct and specific treatment at the correct time, you can get again your vision and loss irreversible. For this, I would like to explain how many risk factors you can develop during your life that can to increase the retinopathy, the diabetes retinopathy. Some of these risk factors, sorry please, I need the next screen in the next text in the screen. This is the imaging of your eyes. In the top is the normal eyes. All of the orange zone is the retina, is the most important structure inside the eyes for you get a good vision. The second imaging is the eyes with a diabetes retinopathy. You know some change like a yellow point, some red point. This is hemorrhage inside your eyes. When this appears, you need immediately ophthalmology treatment for recover the vision or for avoid the irreversible lost vision. Some risk factors can to develop this situation, like more than 5 years with diabetes disease, when you not have a good control of the glucose, when you not have a good control of your blood pressure, when you have some struggle with your weight, when you get too much weight and develop obesity, this is other risk factor for the diabetes retinopathy. In case that you have a smoker habit, it's not really a good option for a eyes healthy visual field. And please, the second, sorry. How you know that all the visual symptoms show you that you have a diabetes retinopathy? First is the change in your vision. It's the first. Can develop like a acute loss of vision, or sometimes it's little by little. But when it happens, you need to change immediately, okay? And other symptom is the flutters. The flutter is some blood point that appear in the visual field that move or not. Maybe it's only a little blood point, but sometimes it's like a really big area of blood vision in your eyes. When this is happen, you need to get ophthalmology consultation immediately, because this meaning that some hemorrhage can develop inside your eyes. And when appropriately treatment can to recover the vision. But when you have most time with the trouble and can to get the treatment, the reversible vision can appear in your eyes. What you can do when you have a retinopathy, diabetes, or when you are a diabetes patient and you need to avoid that the retinopathy diabetes develop. First is have a good control in your glucose level. All of this depends if you make the healthy eating and the exercise like a routine in your life every day. This is the first point. And second, when you note any change in your vision, you need to do the eyes check immediately for any complication and get the appropriately and in just time treatment for your eyes for prevent the blind situation that is really we can get this situation for the patient. And other thing is that you need to avoid any toxic habit in your life. And with all of this, frequently chat with all the specialists that form the team for all your care, endocrinology, nephrology, and ophthalmology too. When all of the chat frequently every year, you can get a good vision, you can avoid the diabetes retinopathy, and you can avoid the loss or irreversible vision. Thank you.
Thank you so much, Dr. Rodriguez. Any questions? Any questions for Dr. Rodriguez? So essentially, we've learned that not having a proper control in your blood glucose levels, it causes deterioration or damage to first the smaller blood vessels in our bodies and later the larger ones. And our eyes have small blood vessels. And once they're damaged, it damages everything, right? So we have waning or lessening in the vision, blurred vision over time, and just complete vision loss, which we don't want, right? How many persons, you don't have to identify if you're diagnosed with diabetes, but how many persons, have gone to the eye doctor, got screening, gone on that machine, or have their eyes examined, or family members? Apart from wearing glasses. Very good. So that's what we're trying to encourage. Instead of waiting until, people complaining of vision loss or changing in the vision, we want annual screenings to be done. So stepping out there, being proactive, and it's part of the multidisciplinary approach to managing someone with diabetes. So that's why we want to encourage persons to know that you have specialists who can get this eye screening done for you at the BVIGC and also privately. But the important thing is to know at least once per year, If not you, your family member, your mom, your sister, your cousin, your neighbor, to get their screen done of the eye examination. All right? So we've learned of one complication of uncontrolled blood sugar level. We have a question.
Good afternoon, everyone. My question is, or two questions. Sometimes when you go and you check your eye, the doctor will say, or the specialist will say, you have a slight astigmatism in your eye. My first question is, what does that mean for somebody who is pre-diabetic or diabetic? And the second question is, what can I do to improve my eye so that, that can be improved, or is it that it can't be improved?
You asked me about the astigmatism?
Yes.
The astigmatism is refractive defects that you have because some structure in the eyes have too much curved surface. For this reason appear the astigmatism. You only can to get the good vision if you use glasses for this, contact lens for this, or surgery laser, that is other option for reduce the astigmatism. It's not an eye disease. No, it's a refractive defect.
So just to clarify, you wanted to know if it was the diabetes that caused the astigmatism or no? Okay. So it's just the shape of the eye is causing a refraction with the light. So it's not cause and effect. All right. Any other questions? What it means for a pre-diabetic. So what does it mean for a pre-diabetic person if they have astigmatism? That's the question.
Okay. In the eyes appear the diabetes retinopathy like a two level. It's a pre-proliferative diabetes or non-proliferative diabetes and proliferative diabetes. No, this is how the ophthalmology specialist described the eyes disease. With pre-proliferative diabetes is when the patient don't have a new vessel that have a normal structure in the vessel. All the vessel structure is abnormal for the retinal tissue. This is the pre-proliferative. When this vessel don't appear, it's only some change like a normal position, some exudate, that is a black point that I showed you before in the screen, and some hemorrhage. When the new vessel and a normal vessel appear and produce some other complication like a traction structure and retinal detachment, in this moment we talk about the proliferative diabetes. Different levels have different treatment. The first is more simple, is most important with the glucose control and all the habits in your life, the routine life, like exercise and healthy eating, all that I told about before. But the second needs something more, like medication inside the eyes, surgery sometimes, and this is the both side of diabetes retinopathy.
Thanks, Dr. Rodriguez. All right. So we'll move on quickly. One more presentation before we do a bit of breakout where persons can visit the tables. We learned about the complications of the eyes. Now we're going to move to another not so popular place, the mouth, right? How does diabetes affect the teeth? And we'll invite from Smile Dental Spa, Dr. Monaghan, to give us some wonderful information. Let us help to invite her.
Sorry, my accent is very strong and Irish, so I hope you can understand me. So my name's Dr. Monaghan. I work at Smile Dental Spa with Dr. Rabin. I know you're probably wondering, why is the dentist talking to us? but if you want to move on to the next slide, we can talk a bit more about it. So, what does brushing and flossing have to do with your diabetes? So, I know most diabetic patients know that their eyes may go, they might have some issues with their kidneys and other whole body issues, but the thing that's often neglected is the mouth. So people who have diabetes are 3 times more likely to have periodontal disease, which is a form of gum disease, and lose teeth than other members of the population. So it's really important that you see your dentist once you're diagnosed with diabetes. And I know it's really hard to get a dental appointment in Tortola, but give us a call, explain the situation, and we'll do our very best. So you can go on to the next slide and explain a bit more how this happens. So evidence suggests that people with severe periodontal disease, severe gum disease, have poorly controlled diabetes, and people also, this poorly controlled diabetes leads to more severe gum disease. So they kind of self-fulfill their own prophecy. And one makes the other worse. So it's really important that we try and get all of it under control together. Also, it's important to know that severe gum disease is turning out to be a risk factor in severe COVID disease. So it's important that that's brought under control with that as well. You can go to the next slide. So problems that can occur, if we go on to the next slide, I'll go through them more. So if we get you nice and early, we see gingivitis. So that's the most simple early form of gum disease. It basically happens when plaque has built up in your mouth that hasn't been brushed away. It then hardens around your gum line and forms that tartar. So sometimes people see it as like a white film on their teeth. That then makes the gums really angry because they don't like it there, and they become puffy and swollen, and you might find sometimes that when you brush your teeth and brush your gums that they bleed. But this is reversible. So if we get you at this stage and we're able to get you a good clean in and talk through how to look after your mouth, then actually everything should go back to normal, which is good. You can go on to the next slide now. So if things get to the point where they've progressed, then periodontitis occurs. So this is the advanced form of gum disease, and unfortunately it's not reversible. It is irreversible, and if we see you and the damage is done, we'll do our very best to halt it in its tracks. So what happens with periodontitis? It's kind of like a long-lasting infection. So the gums are really angry and inflamed at the gingivitis stage. So they're supposed to be tight up against your teeth, and they pull back because they're puffy. So lots of bacteria get in there, and then they start to destroy your gums, your bones, and all the structures that hold your teeth in place. So patients will come to me and say, my teeth are wobbly, they're starting to feel loose, when I bite on things they move. That's advanced gum disease, it's periodontitis. So it might also change how your dentures fit. So some patients think, I've had these dentures for 10 years and I don't understand what's happened to them. It could be the gums. So often what you'll do is you'll see your dentist. They can tell you how advanced you are, what we can do to help, and sometimes if there's really puffy and pussy, you might need some extra medication from us, okay? So we can move to the next slide. I hope you understand me, my accent is very strong. So the other one, now I didn't put up any pictures because I didn't want to put you off your dinner. So oral thrush is another one that can happen in diabetes. So basically, when we have excess blood glucose, there's also excess glucose in our saliva. So the bugs in our mouth that occur naturally, so bacteria and fungi, they love this, like everybody loves sugar. So what happens is the fungi feed on this, and that causes them to overgrow. And because you're a diabetic and your body naturally can't fight infection as well, you get this overgrowth of bacteria, and it leads to oral thrush. So it's different for every patient. Some patients, they come in and they have white patches or yellow patches. Some people have little red marks or crusts at the side of their lip. But a lot of the time, we can manage it quite easily. But the most important thing is getting your blood glucose under control. If you have dentures, it's really important that you take them out at night. I know people don't like to take them out at night, but if you wear them at night, these blood glucose fiends, the fungi, are feasting nice and happily in their bed under your dentures. You're going to end up with some problems. So we need to make sure that we take them out at night. I'll move on to the next slide. Dry mouth is another one. Now, I myself am suffering with this just now because I've had a brace put in, so I'm really feeling my patient's pain. So, dry mouth is a lack of saliva in your mouth, and it's all related to the diabetes. The real problem with dry mouth for you down the line will be that it will lead to tooth decay. So our saliva is really good at fighting off tooth decay, but if we are not able to produce enough saliva, we're gonna get tooth decay. It's also really just uncomfortable. So if you do find that dry feeling in your mouth and you don't know if you're pre-diabetic or anything like that, let your dentist know, because we might then refer you to your primary care practitioner to have your diabetes looked at, okay? So you can go on to the next slide. Oral burning is a funny one. I just put it in here just to give you a pointer. A lot of patients will come and say, I've got this really bizarre tingling or burning sensation in my mouth as if I ate a chili and it just hasn't stopped. It can be a number of things. It can be your folate, your iron, B12, but a lot of the time, once we have sent them to the doctor, their doctor writes back and says, undiagnosed diabetes. So if it's something, any kind of tingling sensation in your mouth that's not normal, let your dentist know, okay? You can move on to the next one. So children with diabetes are particularly important. They definitely need to see the dentist, and I know most people would, I would say, every 6 months. Children, I'd like to see them every 4 months. The reason for that is, once you hit teenager, you start to buy your own soda, you start not brushing your teeth, staying up late. Also, you have teeth coming in, teeth coming out, everything's a bit crazy in there, and there's lots of crowding. So it can be quite difficult to clean. And if the diabetes takes hold and they end up with gum disease at that age, it can be very difficult to ever come back from that. Especially if they have orthodontics and they need braces, the orthodontist will not put the braces on if the teeth aren't clean. So see your dentist and we'll help you talk through how to clean things when things aren't so straight and lovely. You can move on to the next slide. So how will you know if you have problems? Obviously see your dentist, but check your mouth and be mouth aware. Anything that looks different, any red patches, white patches, or tingling, come and let us know. Gum disease can be silent. So if you're a smoker, for example, you mightn't get the bleeding gums, but as well as being a diabetic, so you gotta see your dentist even if you think everything's fine. You can move to the next slide. So I'm banging on about seeing your dentist, but how do you prepare for it? So if you're newly diagnosed and your blood sugars are up and down, plan ahead, call us and let us know, you know, I can be up and down with my blood sugars, I need to have a snack, I sometimes have a hypo. Let us know and we will do our best. We can shorten the appointment times, space things out. If you're nervous, just let us know. We can always sort things out. Don't let nerves stop you from coming and seeing the dentist. We will do nice and simple things and get you comfortable. We don't want anything to get to a stage where we can't fix it, so take things nice and slow. You can move on to the next slide. So I often find my patients ask when I hand them the medical history form, why do you need to know all this? And it actually is really important. So we will ask about your medication, we'll ask about your levels, we'll ask what you're supposed to sit around, what you feel you were around this morning, things like that. We'll check all your gums, we'll check your tongue, hard palate, feel around your neck, all that kind of thing. We'll check your dentures and all your dental work, and we'll take x-rays as well. So the x-rays will check your fillings, and they'll also check your bone levels to make sure that any gum disease hasn't progressed to that advanced periodontitis. You can move on to the next slide. Oh, this has gone a bit funny, but if you have missing teeth, so often we find patients who are diabetic already have missing teeth, and as we were talking with nutrition, if patients are missing teeth, they find that they can't eat the things they used to enjoy, especially things that are good for you like vegetables that you need to chew. There is nothing that can't be sorted. We can go through your options. So I'll just look at it really quickly here. So the first one is the dental bridge, so that expands between two of your teeth and it's a permanent thing, okay? The other one is a dental implant. It's a titanium screw. and it lasts about 20 years, and they're really, really good, but you'd need to get any gum disease under control. And the third one would be a denture. So it can be a full denture if you're missing all your teeth, or it can replace some spots in your mouth all in one thing. And that's something that comes in and out. So, smoking, I know it's been touched on already, but smoking makes everything worse. It will make your gum disease behave silently, and you won't find out how bad things are until it's an advanced stage. It can also lead to oral and mouth cancer. So any red or white patches in your mouth, we'll have to investigate for that as well. And it can lead to bad breath, discolors your teeth. Stopping smoking is the best thing you can do for your health. So if you are smoking, do stop, please. And you can move on. So what can you do to keep your mouth healthy? So when you come and see us, we'll talk you through all the ways to do it, specific to what we see in your mouth. But here's just some general tips. The first one is keep your blood glucose as close to your target number as possible, okay? So secondly, we would say brush 2 times daily with a fluoride toothpaste. Any toothpaste that is not a fluoride toothpaste is doing nothing. So we would definitely say do that. Brushing in the morning after you've had your breakfast, but the most important time is brushing at night. So at night before you go to bed, I know we're all tired, but don't miss it out, because everything you've had that day is just sitting on your teeth and it is going to rot them. We would also say don't use a hard toothbrush, because a hard toothbrush will just wear away at your enamel, so use a nice soft toothbrush. If you can't find it in the supermarket, a kid's toothbrush is the one to go for, because they're nice and small and they can get into all the gaps. Use small circular motions and brush all the surfaces, so the biting, the smiling, and the tongue side of all your teeth. And also, when you brush, I know all the ads on TV and on the internet show someone rinsing out their mouth or rinsing with a mouthwash after. Do not do that. Mouthwash is for a different time of day. It is not for after brushing your teeth, because all that does is it rinses the fluoride from the toothpaste off your teeth and spits it down the sink. So no good. Just brush with the fluoride toothpaste and leave it. Walk away, don't rinse. Okay? Next slide, please. Everyone does it wrong. I only found out when I went to dental school. So this is just a kind of little image of how to brush. So you're kind of brushing at a 45-degree angle, because you're not just brushing your teeth, you're brushing your gums. So up towards the gums. And you can move on. The other thing, as I said, about the mouth rinse again, brushing in between your teeth. So I know dentists talk a lot about flossing, and everyone rolls their eyes, because it is really hard to implement that into your routine. If you find that it's just, you're too busy, there's too much going on, the next best thing, and actually sometimes it's a better thing, is something called a water flosser. So it basically looks like an electric toothbrush, but it jets out water at really high speed in between your teeth and cleans everything out. It's really easy to incorporate in. You just do it before you brush your teeth, morning and night, and that's going to help prevent any gum disease as well. Also, take your dentures out at night, and if you've had your dentures for years, just double check with your dentist the best way to be cleaning them, because every denture is different, and some of the little fizzy tablets aren't right for certain types. So you can move on to the next slide. That is me. Any questions? Please don't hesitate to ask.
Thank you, Dr. Monahan. Any questions? Any questions? I have a question. How often are persons diagnosed with diabetes, expected to have a dental exam?
A dental exam, I would say every 6 months. Dental hygienist, I would say every 4 months. So,
every 4 months?
Yeah.
Okay. And given our environment now and the cost factor,
yes.
how is that in terms of NHI, co-payment? The same services are offered at the BVI HSA, yes, but in terms of accessibility?
So what we always use NHI in our practice. So if you didn't need any further treatment and you were coming your 4 times a year dental hygienist, that would be covered with your NHI. Dentures are also covered, dental bridges to a certain extent. Examinations, x-rays, it's all covered by NHI. So you'll just pay your 10% copay.
Okay, 10% copay. Thank you very much. So, no mouthwash after brushing.
Mouthwash,
So when do
please.
we use the mouthwash?
Just at a different time of day. Just put it in the bin.
So after
If you
lunch
have-
at work.
If
Okay.
you have severe gum disease, there are certain types of mouthwash. But your
Okay.
dentist will let you know.
Yeah, we've definitely been doing it all wrong.
Yeah.
Thank you, Dr. Monahan. So we only have 2 presenters next, so we're gonna go right through with them, and then persons can get your screening done. Next, we're going to move to a different area of the body that can be affected by high blood sugar levels, diabetes, i.e., is that a question in the back there, or are you just raising your hand? Oh, okay, sorry. Right, so changes in the bone, the muscle, the nerves, how it affects movement, when you get ulceration, how you can get your body healed and the skin healed. And so we have Dr. Jerry Smith from Therapy Works, who will be giving us a lot of discussion about that aspect of diabetes care and management. Welcome, Dr. Smith.
Good evening. It's tough to follow really smart people. I'll try not to put you to sleep. Matter of fact, may I ask everybody to stand, please? Just kind of get up, move around a little bit. If anybody falls asleep, I'm going to throw the mic. All right, sit down and get back up again. Simon didn't say, just kidding. Just go ahead and sit. All right, so as said, my name is Dr. Jerry Smith. I'm a physical therapist. I am the CEO of Therapy Works. Just a little bit about us. We started our practice on St. Thomas 14 years ago. Since then, we relocated here in the BVI on Tortola First and in Virgin Gorda. So we offer full services at all of our facilities full time. So every day, well, Monday to Friday, we're there for you. I was asked today to give a short presentation. We have to go where? A short presentation on diabetes and physical therapy. I'll tell you up front, I have a few definitions in there on what diabetes is and things like that. I'm going to pass through these because they've been well covered today. I'll just go through some quick, fast facts. The 2 out of 3 people with diabetes die from heart disease or stroke. Did you know that? That's unpleasant. Diabetes is the leading cause of kidney failure. Diabetes is the leading cause for new cases of blindness among adults. We heard a bit about that earlier. And the rate of amputation for people with diabetes is 10 times higher than people without diabetes. It's about 60 to 70% of people with diabetes have mild to severe forms of nerve damage that could result from pain in the feet and hands, slowed digestion, sexual dysfunction, and other nerve problems. You all didn't know about this one before, right? It does. All right, so what is diabetes? I'm going to skip over that because that was well handled by the previous speakers. And I think definitely I'm going to stay away from that. I'm going to stay into my wheelhouse and I'll go into what is physical therapy. I realize I've been speaking on my side. Okay, good. All right. So what is physical therapy? And I'll give a very basic definition. I could probably stand here for an hour and just speak about what physical therapy is, and I put all of you all to sleep, and I don't want that because I will throw the mic. Physical therapy is the improvement of quality of life through prescribed exercise, hands-on care, and patient education. Hands-on care, things like massage, joint mobilizations, and other physical activities that the therapist would do with their hands on you physically. And then most of what we do is from very specific guided exercises. And that's really where the majority of the benefit is in this regard. Now, how does physical therapy aid with diabetes? Now, to understand how physical therapy aids with diabetes, you first really have to understand how diabetes affects the body. So think back about the definition given about the metabolic changes and how insulin works and all this sugar running through the body. Really, how physical therapy assists mainly with diabetes is how physical activity affects the diabetes. It's the uptake of the glucose. It's utilizing all this free glucose running around in your body, getting up and moving, where you ever smell water when it just sits in like a gut or something? When water doesn't move, it stinks. You have to move. Life requires movement. When you don't move, things just don't work, right? So always think about moving. And after you see all the people walking back and forth, it just makes me so happy. I can give a long talk on how you should exercise, when you should exercise, why you should exercise, but I wasn't asked to speak about that today, so I ain't gonna do it. All right. So with that, the most important thing for diabetes, if we start to talk about how to care for diabetes, I think we started in the middle of the book. We need to start in the beginning of the book. How do we prevent diabetes, right? It's the great things that Ms. Matthews spoke about with nutrition. I was debating today whether or not to say this, but I'm going to. For the folks in the crowd that knows me, they know that I don't pull punches at all. I say what's on my mind and I mean it. So most of the people in this room that have diabetes, you have a duty to all the people who follow you in the line. If you're a grandmother, if you're a mother, if you're a friend, neighbor, the way you got diabetes was really because of really bad choices. And the folks that you prepare meals for, what you're doing is really giving them a nice roadmap to get the same thing. So you have to make better choices and teach folks how to make better choices about what they eat, the activity level you're doing. If you're giving your children the same thing that you ate that helped you to get diabetes, guess what you're giving them? A great roadmap to diabetes themselves, right? Prevention is the most important thing. It is choosing the right level. Okay, so if we start to my learned friend over here, Ms. Matthews, she speak about nutrition, and she'll go through some really complicated things about what you could eat and how you should eat, whatnot. Think about it very simple. I'm a simple fellow. I like things to be simple because then I can understand them. I'm not the smartest person. I'm not the sharpest pencil in the box. It's a math equation. The food you take in is positive. The activity you do is negative. If you want to have a healthy body, you have to do more negative than the positive you do. You have to be more active than the food you bring in. So then you're not gaining weight, you're not storing fat, you're not getting unhealthy because your balance is not there. If anything, you want to be a little bit negative. Let the body use some of the stored energy you have. You see, I have a good bit stored right here. I want to get rid of it. This is too much, right? And some have a little bit more than me. Let's work together to get rid of it. I have some to sell. So prevention is very, very important. But once you get past prevention, okay, the diabetes is there. You're coming to a person like me. What are the roles that a person like me would do to fight diabetes? So there's some categories, right? So one is that guided exercise. We want to get you through activities that would get you going. You want to burn those calories. And I speak about nutrition a lot, so I'm glad I have Ms. Matthews' name to call. Sorry, I've called your name more than anything else tonight. I'll probably call it some more. I ain't gonna apologize yet. So, the things you get in, she spoke quickly about the nutritional chart, the nutritional facts on there, that the total carbohydrates, that's equivalent to saying total energy. That's the plus side. The negative side is the exercise, how much activity. So guided exercise, the things, when you come to somebody like me, and the doc says this is a diabetic person, they're having issues, and we'll have a list a little later of what those issues would be, but you want to then utilize exercises, one, to just burn fat, burn calories, but also to work on some of the deficits that exist. The deficits would be in balance, the deficits would be in strength, would be in coordination. We've now heard a few presenters speak about nerve damage with diabetes, where we spoke about in the mouth, how that affects there. We spoke about the eyes and how that affects that. Well, it happens the same way in the feet. The small nerves in the feet, in the fingers, when they start to get damaged, it affects balance, coordination. The way balance works is all of the muscles in your legs, they work together in a coordinated way to stop you from falling on your face. They get that information by the information that travels on the nerves. When the nerves get damaged, the muscles react slowly, and your balance is poor. So we would work on things like that. Well, one of the challenges also, once you start to have that damage in the extremities, in the toes, in the feet, and the fingers, one of the things that often results, which makes life really, really challenging, is amputation. So doing things prior to that, things like wound care that we would do to help you take care of your skin, to make sure that you don't have that breakdown, that damage, that will unfortunately eventually result in having to take that portion of the limb off so it doesn't affect the rest of the body. So those are the things that we would work with, that clinical physical therapy prior to amputation. And then if an amputation happens, and there are all sorts of amputations that can happen and can result, creating different levels of challenges, of which we can all work through, whether it's removing of a toe, a portion of the foot, removing a lower leg, removing above the knee, and then having to use prosthetics. That's a whole different area of what our practice offers to assist persons with prosthetics and to get you going with that. But Amputation Services is another one of those things that we do. So guided exercises, pre-amputation type of activities, and then amputation services would be the things. We've recently reached out to a few interesting things that we've done in the last year. Things that we had planned to do before, but that terrible word COVID, that thing that really has us all looking like we're going to rob the place tonight. We had plans to implement some of these things before. We've kind of slowed some of those activities, and we're getting them going again. We actually onboarded an exercise scientist into our clinic, and that person will be doing very specific guided exercise programs. So it would be a step outside of what we do with our regular physical therapy plans of care, where you come in with a referral and we go through exercises. This person would bring you in on a one-on-one, do an assessment of strength, balance, proprioception, flexibility. And based on that and your medical challenges would create a very specific program for you. There's some folks that are really, really nervous about going to the gym. They don't want to go into that environment. It's not comfortable. So our environment I feel, I'm a little biased though, is a bit more comfortable. It's less weights clanking in the corner and these young people with sweat all over the place that wants to make you feel like you're 100 years old. So it's a much more inviting environment. You do that, you have a person who understands the activities that can really hold your hand and walk you through the process, and it'll be very specific. So she has been onboarded, and we're slowly bringing her in as we have clients for her to see. We've also created an MOU with a company out of Virginia for prosthetic care. So Shore Prosthetics, I think I'm getting the name correctly. But they're coming on board and working on some of the legal aspects of it, or work permits and all of that kind of stuff. But we're getting that person in so they can come in. We can have all individuals who have prostheses that they're having challenges with, so we can get new prostheses or make adjustments to the ones that they have. And then for persons who are in need of those services for the first time, they can have access to that. So those are the things that we do. That's how we would do it. And I think that is all she wrote. Do we have any questions, please? I've either said it all or I put you to sleep. One of the two. Let me put this back on so I can look like a robber.
Thank you so much, Dr. Smith. Before you go, I have a few questions for you. I'm very excited about all the treatment modalities that you mentioned, but how do we get to you? How does someone with diabetes come into to Therapy Works and get to a session? Well,
thanks for the question. So quite easily, starts with a telephone call, right? So in the Pear Park, our telephone number is 4678, or you can just visit our website at therapyworksvi.com. So just making contact. In most instances, most persons utilize NHI. It does require a referral. So your primary care physician would write a referral. We would get you in. We do a one-on-one consultation. If that's the main model pathway. If you're looking to do one of the other services that I just mentioned, those are non-NHI covered services. So you just call us directly and we set it up.
Prosthesis and
Prosthesis.
exercise physio.
Well, the guided exercise program, mainly for that, would be the non-NHI. NHI does cover prosthetic care. Some of the nuances are being worked out. This is a new line of service for us. I could tell you that the prosthetic company, when they did this independently in the past, there were some challenges that ensued, but I really believe it's because they didn't have a local partner and things just kind of fell between the cracks. So you're just giving us a call and we'll kind of get you in.
And how about home care?
We also do home care. Actually, I saw 2 home visits today. We also have a bit of a challenge at our facility currently with access. So because of that access, I'll just speak plainly. Our elevator has been problematic and we've been fighting with our landlord. Sorry, drama, right? But because of that drama, we've been going to the patients. All the patients that have access challenges, we go to their homes to make sure that we provide the level of service that they require.
Thank you so much. So, Dr. Smith, I'm sure a person will be reaching out to you. I'm very excited about the fact that you have the whole exercise program coming along, because persons oftentimes are intimidated, just as you said, about going to the gym. They don't have somebody to guide them, you know, as like a trainer. Having a program tailored to you specifically,
yes,
gives a lot of motivation for persons.
And actually, and it's not just limited to those persons. I might just, for the persons in the audience who may be interested in just knowing how fit you are, that person is also available to do those assessments. They'll come and do a PARQ, find out if there's any health challenges that you should know about, and she may ask for clearance from your medical doctor. And once everything is safe and it's okay to proceed, then she will go through, tell you what your body fat percentages, where you fall with BMI, what your percentage of muscle mass. We actually have a device that will tell you what your metabolic age is. So some 30-year-olds walking around are actually 80 because they're so unfit. And some 80-year-olds are 22, believe it or not. So, yes, we can do all of that for you.
Okay, thank you again, Dr. Smith.
No, thank you.
All right, so we're almost at the end, and you know, we've heard about how diabetes affects our eyes, how it can affect our skin, our muscles, our movement, how it can affect our teeth, our oral health, and how important it is to have good nutrition. But that's all taking care of the physical. Now we're gonna hear about the mental aspect, right? Some persons, after having a diagnosis or just having a family member diagnosed, it brings a lot of depression or sadness. You know, what am I to do? I don't know. I need somebody to talk to. Or just caring for a family member who has difficulties with diabetes can be quite a stressor. So I'm gonna invite our community mental health team, Nurse Renee, to come and just give us a small talk on coping with diabetes. Let's welcome her.
Good evening, everyone. I'm so happy I'm the last person, and I think I have the easiest job, because everything has been said already. Coping with diabetes. First, what is coping? Being able to live anything difficult, basically. And let me just start by saying, being told that you have diabetes is not the end of the world. Being told you have any condition really is not the end of the world. I think what we have to do in terms of coping, what we have to do, first of all, is understand ourselves. How much can I take in? How much can I manage on my own in terms of information? When you're told you have diabetes by your doctor, the first thing you want to know, first of all, if you go to the doctor and you're not feeling well, You need to know whether you can go alone and take information on your own in terms of you understanding stuff. So you may want to go with someone. That alone is going to give you a bit of ease, knowing that you have somebody with you who's going to help you, if in case you don't understand what the doctor is saying, to at least explain to you again. Secondly, you should not be afraid to ask questions. What do you mean, doctor? What are you saying to me? Tell me in the simplest form, what are you saying to me? As doc say, we say sugar. You have sugar. Because saying diabetes, some people don't understand what that means. So tell me, doc, in the simplest terms, what are you telling me? Tell me, doc, what body organs have been affected. And at the end of the time, first to really cope with what we're being told, we have to come firstly to acceptance. If we don't accept what's happening or being told, we have a problem. We'll be going wrong in circles, getting ourselves frustrated, come back to the same point. So the first thing is accepting that you were told you have diabetes, accepting it. That's how you're going to start coping with anything. And in our case tonight, we didn't have diabetes, so being told you have diabetes, the first thing you have to do is accept the fact that you were told you have diabetes. Where do I go from there? Coping. Where do I go from there? Doc, what am I supposed to do? What can I do? When you're diagnosed with anything, the next line is, what do I do? You don't give up on life. Doc, so tell me, what do I do as it pertains to my intake? What do I do as pertains to my exercise, my activity level? How did I get this thing? How can I help my family members not get it? So coping, again, as I said, firstly, you have to go with someone to help you, to sit with you and to comfort you. You figure you can't take information alone, because sometimes it can overwhelm you, especially if you're very young. Because sometimes some people, you know, you can get diabetes different ways. You can be born with diabetes because of some fault to an organ, to a pancreas, or you can get diabetes from an accident and your pancreas get damaged, or being told you have HIV, if you have a severe infection that was not managed properly, if you have certain other autoimmune diseases, can affect your pancreas, and then you end up with diabetes. And those things can happen at any age. So you can have an accident at age 21, 22 in a motor vehicle accident, and because your pancreas got damaged, you are now told you have diabetes at age 21. So at different ages, it may be difficult to accept that you have diabetes, but you should still, the first thing, you should look for support. Support from family member, from a co-worker, anybody you know you can lean on. That's how you're going to cope with what you're being told. Get support from someone out there, or someone who has the situation, who's dealing with diabetes already, who has overcome the fear and the anxiety, and who's living a fulfilled life with diabetes. So some persons have support groups. You join diabetic support groups where they meet and they discuss their challenges, they discuss their diet, they discuss their exercise, their lifestyle changes, they discuss how they went through it. And so that can encourage us and encourage you and strengthen you as to how to deal with your diabetes. Because all you really want to do is know how to cope with what you're being told. Like I said, so allow somebody to go with you to the doctor, one, to help you understand what you're being told. Feel free to ask questions to your doctor in the simplest terms so you understand what you're being told. Accept what you're being told, and then say, where do I move on from there? What do I do? Intake-wise, exercise-wise, sleep-wise, everything is important. As all different areas already mentioned, you have to look at every body organ. How do I take care of my eyes, my teeth, my skin, exercise level, everything? But the most important thing is, first you have to accept that I have diabetes, and what else can I do to make sure I live a fulfilled life? It's not a death sentence. Persons survive diabetes all the time and they live a fulfilled life. So you have to just willing to make changes. You have to be willing to accept that you have this thing. And sometimes I encourage my clients when they tell me, I have to take tablets all the rest of my life. I say, well, there are persons with diabetes or whatever take things the rest of their life. So we have to accept we have this thing and work with it. Do not give up on yourself. You may have diabetes, somebody else may have high blood pressure, someone may have cholesterol, and we all have to learn to realize that you're not alone in this world. You maybe have diabetes, but somebody else has something else. So get a support group, talk to a friend, member of your staff at work, a team, good friend, somebody can support you, church member, anybody who can just support you and be with you. And stop thinking of yourself as less than anybody else because you have diabetes. You're still very beautiful, you're still very handsome, you're still very important, you still have life. Once you're alive, God is not finished with you. Thank you very much.
Thank you so much, Nurse Renee. Thank you so much. So we're at the end, just one more activity, but before we move on, do we have any questions, any clarifications? Yes.
pleasant good night. Is diabetes reversible?
So the question is, diabetes reversible? Who would like to answer? Dr. Inyesi? One, they can't hear you. Nurse Renee, one minute.
I've had persons say that it was reversed, but I think too it's mainly because of they took charge of their life. Their intake, exercise level, their way they think about life is, because if we just give in, but if you take charge of it, I think you can manage it. But once you're predisposed to something, we can always relapse, so you have to just take care of yourself.
Dr. Cruikshank?
So that's a really good question regarding if diabetes is reversible. And the term that we tend to use is diabetes in remission, meaning that the person is still diabetic. However, their sugars are so well controlled that the A1C, which is a clinical parameter that we use to monitor their blood sugar levels, are similar to someone who is not a diabetic. So the term that we use is diabetes in remission. For some persons that require exercise only, other persons exercise and diet, and some persons exercise, diet, and medication. So it can go into remission, right? And some persons, they do so well with their lifestyle changes that as time go by, we tend to decrease some of the supportive care that they require. But they still will have to follow up with their dentist, with the dietitian, do the exercises to ensure that we decrease the long-term complications of the diabetes.
Thanks, Dr. Cruikshank. That answers your question? All right. Any other comments?
Diabetes in pregnancy, if you could just touch a bit on that, what causes it, and if you get it while you're pregnant, does that mean that you would have diabetes for the rest of your life?
Dr. Inyesi?
Good evening. My name is Enesi. Sorry for my English. I am endocrinology. I working as endocrinology for more than 25 years. I am very happy to stay here with you. Diabetic pregnant is a genetic problem. Not every woman develop diabetes pregnant. Only the woman that have some family or some predisposition genetic, and it's very important the pregnant to program the pregnant in a younger age, not to older people, woman, not to too younger. No less than 18, no more than 35 years, because this age is risk to develop diabetes, gestational diabetes. And if the woman have diabetes, the woman can have a very good pregnant, is have a very good care in her diet, in exercise, and in the medical attention, because in the most frequently pregnant woman need insulin therapy during the pregnant. After the pregnant, the woman need follow, because sometimes the woman after deliver can stop the problem, but continue with risk. Sometimes it's necessary continue following the woman, because sometimes continue with diabetes. Sometimes not continue with diabetes, but have risk. In this case, better to follow the woman for more than 2 years. Do you understand my English? Do you understand all? Thank you so much.
Thanks, Dr. Inyesi. And just to add to what she said, that's why it's so important to have antenatal care while pregnant. Go visit, you can start antenatal care with, your neighborhood clinic, that's fine. Transition to the actual obstetric clinic system. And part of the screening during pregnancy is a glucose test that's done. It's called the O'Sullivan test, just to screen to see if the pregnant woman has a risk for diabetes. Depending on the result that comes back, they will go through different treatment modalities. And as Dr. Iniesi says, just by delivery, or even before delivery, maintaining a healthy weight, nutrition, also important, and any other lifestyle changes or stressors that may be occurring during the pregnancy itself. If you can control that, you can have a healthy blood sugar level during the pregnancy, because high blood sugar levels also affect the fetus, the baby in utero. At delivery, just by delivery alone, it can reverse, the incidence of the high blood sugar, but following up is very important. Some persons persist with having the elevated blood sugar levels and are considered diabetic at that time, not just diabetes in pregnancy, but having chronic diabetes afterwards. So follow up and real close monitoring by the healthcare team is important. Wonderful questions. Anybody else? No? All right. So our last segment is that we'll give persons an opportunity to visit the primary care service team. They're at the back of the sanctuary. Right there, you can get your blood sugar levels done, your weight, height, where we calculate a BMI. You can also get your blood pressure done. Dr. Rodriguez, for those persons who would like to get, just a quick eye check done, she can look at your retina like she was showing you at the back there. Community mental health to my right over here, you can get a few information on your coping skills as we discussed. Nature's Way is in my far right over there. You can learn about some good food sources to help with your meal prepping. Red Cross, BVR Red Cross is here. And just a few acknowledgements. I'd like to thank the Upper Room Victory Church, Bishop Herbert and his team for their wonderful hosting of our event at this time, or other supporters or presenters, Dr. Jerry Smith from Therapy Works, Dr. Monaghan from Smile Dental, Drs. Iniesi and Rodriguez, Miss Matthew for coming, and Nurse Renee for presenting, our support team from the BVI HSA Primary Care Services. I see Dr. Fred here, our director, and also our internal medicine support team, and our organizing team, Dr. Cruikshank and Miss Matthew. I see other Cuban delegates in the back. And of course, the community from East End here for coming out and just taking time to want to know more about diabetes and access to care. So thanks again for coming. Safe travel home. Take time to go through each table. And we have other events which are coming up. There'll be a health talk at Church of God of Holiness in still East End, but down that side. And also, don't forget, at any time, you can stop by the Longlook Clinic or the East End Clinic to get just general screens done, information, ask the nurse anything if you want to do a quick checkup with the doctor. And I'm not sure our presenters may be here a few minutes after. You can approach them with any information. Miss Matthew is also here. She can give you some pamphlets on nutrition and any final comments, thoughts, anything? Nope. All right, thanks again for coming out, and do have a safe evening.